And that's why I've been reaching out to the hauler community and people at the back end of the system, because if we don't get people to go on camera, or we don't make the reality of the seriousness of the situation, bring this home to a broader group of people. We can't just talk in our own industry to each other. We have to get this broader. Otherwise, we're not going to get enough support. People won't see the problem, but when they do see it, they always want to do something. So that kind of leads me into the next discussion. And I know you had mentioned this, that voluntary is voluntary. It means that people do things voluntarily. And so it's not happening right now, unfortunately. We wanted it to, and I had asked for partnerships back in 2010. I know there's a lot of conversation with different groups, but we're really getting literally almost nothing. And it's from TED's 200 letters, certified letters to producers. We have tried every possible way we know of. If somebody's got a great idea, we're all ears, but we've not found a way to get industry's attention that this is something that needs to be done. So with that, we've got to find some solutions, and it may be transitional. What I call transitional to producer responsibility is the producer may not be completely responsible yet, or it's not a legislative mandate. We may not, that may not be what happens right away. It may be that we just get local hospitals to partner with so-and-so, or we work with Tom and try and figure out, can we get at least some sort of policy where you can't sell Sharps and distribute them without at least the return container to take them back safely to somewhere. And then the somewhere part we have to figure out in a different place. But there's lots of ideas that I'm sure you all have, and I certainly have some too after listening to all these great speakers. But I'd love to open it up now for just some brainstorming. You've heard a lot of good information here, but what are we going to do from this point forward? And does anybody have either questions that would help them come to a conclusion on what to do, or do you have ideas on what to do? Because Donna's got the microphone so that the people who are listening can hear you at home. And I believe we have over 60 on the line right now. Anybody, Jeff? Okay. Donna's going to be our Vanna today. All right, so Jeffrey Smidberg with Santa Cruz County.
Great. Well, one part of the problem is, since this particular to California right now, is that needle users are required to use a approved container to transport and get rid of their old Sharps, and it's a cost barrier. So one option is for the container to be delivered when the needles are first purchased. Another option I just wanted to mention that we've been able to do in Santa Cruz County is there's an HMO that serves low-income people. It's called the Central California Alliance for Health. It handles Medi-Cal money, and I think they have something like 30,000 members in 3 counties. And we went to their board of directors a year ago and said, you're prescribing these injectable medicines to your members, and then what are they supposed to do afterwards? A lot of these are all low-income people, and then the state law says that they have to buy a Sharps container. How are they going to be able to do this? Can't you allow the doctors to prescribe the Sharps container when they prescribe the injectable medicines? Well, their board approved that, and so that program has been in place for since last January or February, most of a year. So great possible solution, except that in practice it's not working well. We're having to work out some of the details and exactly how do you implement that. Everybody has to understand that that option is available. They use an NDC code, which is a drug code for tracking and so forth. Some of the cheaper Sharps containers don't have NDC codes. Not all the pharmacies are carrying the right container that their benefit is going to pay for. We're trying to work out some of those details, but let's just quit working on it. So anyway, that's one possibility, working with the HMOs to allow that to be a member benefit so that the insurance, basically health insurance, that pays for the drug can also pay for the Sharps container.
Great suggestion. I'm glad you brought that up because I thought that was important. Nobody else I know of has done that around the state, except Jeffrey was able to get that one HMO group to cover the container cost for the low-income patients. So there's that two-phase problem, the container, the disposal. And everybody knows that the big problem is the cost of disposal. So we've got to find the money from somewhere. So we can talk about local pilot projects, we can talk about big statewide education, we can talk about legislation, general policy, partnerships on certain things to get data that fills in data gaps to feed a solution. I'm sure you guys have some ideas. And I'm sure if you're out there listening and you want to email one in, Donna, I think, Ted, is that you can email Donna at donna@calpsc.org and she can read the idea to the audience here. So Ted?
It's an idea to start a pilot program. Hello? In Delaware County. Every other word I'll try to make count. So we're still eager to try to get a pilot program established in Delaware County, probably after the grant period. But one opportunity that I think may exist with us is to possibly collect and consolidate the Sharps and bring them to a local hospital that has an autoclave machine. And so my question both to the group and to anyone listening online is, does anyone have a local hospital that is doing this? Does anybody have a local hospital that has accepted Sharps from the general community for the autoclave?
So that would get rid of the end-of-life cost. So if you collect it at the public facility and then run it to the local hospital that has an autoclave, that might greatly reduce the cost of the community for disposal. That's the idea. So if you have done that, please email Donna at calpsc.org. Okay. Any other ideas that you have out there? Yes, Mike. Mike's always full of good ideas. Mike Mahajer with LA County Task Force. He's also on our policy committee, and we're very grateful for that. Mike's been in the waste business for a long time.
I wasn't going to talk, but one program that may at least put a light in what is going on at the pharmaceutical is, SB 41 that was passed and went into effect this year. It is basically a needle exchange program that would allow the pharmacists to sell up to 30 syringes without prescriptions. In order to be able to do that, then the local health officer has to permit the pharmacist to do this, to sell it without prescriptions. And as a part of the requirement of SB 41, the pharmacist has three choices: what to do, what not to do. And most of those choices involves with providing the customer with the mailing return containers. So really, as a group, would be good if everybody in each county start talking with their health officer to see how they are enforcing the requirement of SB 41. The SB 41 is only a 3-year program. It's supposed to sunset in 3 years and went into effect this year. So once this program is started and the pharmacists are forced, they want to participate to actually provide the container, that may help the pharmaceutical to have a better understanding of what we're talking about and why we do want to have a program. So it is a starting point, but it is in the right directions, but it needs something that everyone over here needs to be forceful with a local health officer, whether it's a city health officer or a county health officer. That's pretty important.
Okay, so you're saying that SB 41, which provides for the needle exchange. It's up to 30 needles, right?
SB 41 allows every pharmacist in California to sell up to 30 syringes without prescriptions.
Okay.
In order to do that, they also have to provide a program for collection of used Sharps.
Okay.
And everything has to be approved by the local health officer.
So you're suggesting that every city and county talk to their health officer and see how they're implementing this, because this could be part of your long-term solution.
This is what they have.
It's a great idea, Mike. Yeah.
And that's where we need to push the local health officer to enforce it. In LA County, for example, is the LA County Department of Public Health that is required to enforce, and they issue the permit. So now they are becoming part of the solutions, because they have to enforce the SB 41 if they want to allow the pharmacists to sell up to 30 needles.
Okay, so probably who you're speaking to are the local government listeners out there in California who could talk to their local health officers about how they're going to implement the take-back program and the needle exchange under SB 41, and that would, but it's temporary, this break, so you don't have a lot of time to get this, talk to them, get it set up, and get the program going, get some data. But that if they do the take back, then that could be something that maybe could be piggybacked on for other types of needles, not just the exchange.
It is a temporary program, but it is 3 years.
Right.
At the end of the 3rd year, the legislation provides that depending on the result, they may extend it beyond the 3 years, or may go back to the law that was in existence last year, which would allow sale without prescription up to 10 syringes.
Okay. So it's very incremental. So what we're seeing kind of this pattern in California is incremental chips away at little bits and pieces around the issue, but we've never really solved the sustainable funding issue, and who's really responsible?
But the part of the deal is an outreach.
Yeah, outreach.
Politicians, and the pharmacists,
Right.
and the pharmaceutical. The reason, for example, I was asking earlier about the Walgreens, Rite Aid, Save-On, and these are these pharmacists that I work with as a part of the needle exchange program, that they sell this stuff, yet they just don't want to talk about it.
Right. Well, and that's why Bill did what he did in San Luis Obispo, is because he said, when I did a voluntary outreach, they were not responding. So he had to put in a local law in order to get the kind of convenience that they were looking for in San Luis Obispo. And we've talked about this many times. There's lots of other people I talk to in local government that would like to do what Bill's doing, but the politics are such in some areas they've just not been able to do it. So it's a different solution. That's why we like to show you all the different variety of possible solutions, and you can all figure out what might work for you. So that's another great idea. And yes, this gentleman here, can we get you the microphone so people can hear you? Thank you. And who are you with?
City of Los Angeles.
I'm sorry, the mic is actually the little thing. Yeah, there you go.
I'm with City of Los Angeles. I'd like to comment about the discussion about the bill. I don't think it is a really needle exchange program. It is allowing pharmacies to sell more needles. And in effect, it's a market-driven thing. If they can sell enough needles so they can pay for the collection of Sharps, they will do it. Otherwise, they won't. That's the point, my point.
Well, it does require, if they are going to do it, they have to allow take back. So
Right.
that's the take back part of it that we're interested in. Because if they do choose to do it and they have to have a take back, can they maybe offer the take back in a larger, for more Sharps than just that very specific needle exchange program?
This is not needles. It's not. You don't have. There is no exchange of needles. If they want to sell
Okay.
up to 30, they have to allow taking the Sharps back.
Okay.
They have to have collection of Sharps. So if they decide that it's not worth it, they won't be selling. They'll be selling 10 needles or syringes, whatever is there, and not having any collection. That's my point. So they have to make enough money for selling extra syringes to have a collection of Sharps there. That's my
Well,
point.
I think it's partly a business decision as well.
Yeah, that's what I'm saying.
Okay, so we agree. It's a business decision. And that's always the thing in a voluntary program, and that's the way the bill was written, was they don't have to do this. But you can talk to your officer and see what they are going to do, and then maybe, you know, push them along. Maybe that's something that local governments can be doing now, utilizing the bill that's already passed last year. Other ideas. Wide open brainstorm. No bad ideas. Yeah, Jeffrey? Jeffrey's got a good idea. Because I have some, but I don't want to get to mine until I hear all your great ideas. I think Nancy has one too.
Well, of course, there is one really big elephant in the room, good idea that we haven't talked about. Maybe you'll talk about that. But just to give a little more background on what the situation is out there. In Santa Cruz County, we have voluntary take-back, and many of the pharmacies are participating now, but not all. But in addition to those sites that are willing to publicly be recognized as take-back sites, I just wanted to point out that there is a lot of informal take-back going on for both pharmaceuticals and Sharps at some doctors' offices, at some clinics, at some veterinary hospitals. Mm-hmm. This is service, you know, the facilities are just, you know, interested in serving their clients, you know, providing good service to their clients, and so they do take back some of these things. And, you know, as a medical facility, they're already set up with medical waste collection, and so if they get a little extra, either Sharps or medicines, they can take it back, and it's really only a marginal cost to them. So just want to recognize that there is a certain amount of that, and I don't think anyone has been able to predict how much, but I know in Santa Cruz County there's a fair amount of it. Mm-hmm.
Well, you know, I'm just going to throw out one of my ideas, because I think one of the big problems, what I've heard today, is that there's a huge lack of understanding of the problem on the public side. So if we've already got the LA Times reporter who wanted to be here today, unable to be here, we'll follow up with her, we'll do the interviews, hopefully we'll get a nice big article in the LA Times, which usually gets some play, and then we can maybe build off that for other articles across the state, because a lot of other smaller papers pick up the LA Times articles. So that's one thing, to just raise public awareness. But I really thought that TV spot from Washington really did do a good job in 2 minutes of explaining what the problem was. And they did do a good job of, I thought, was the solution part. So if we could get in LA, in other parts of the state, TV coverage of a facility that's having these issues, which all the facilities really are, and we can get our facility operators to open the doors to TV cameras, which I know is scary, and it takes, you know, some preparation, and you don't just want to let anybody in with a TV camera because you're dealing with a lot of waste and it's dangerous and you got to be careful. But if we could do that and really start telling the story to the public and show them that real people are hand-picking through their recyclables and they are in danger of getting stuck, I really think that would make a difference. So you're not making the point, gee, it's illegal, bad on you for throwing them in the trash, because a lot of people don't get motivated by that. They actually go the opposite way. So I always like to tell them what they can do. So if we say, please don't do this because of this health issue, it's human beings and it's a safety thing, but the good news is blank. You know, we have whatever it is locally, or if you don't know where to bring them locally, if you don't have a hazardous waste facility, ask your doctor, ask your pharmacist, ask your veterinarian. And if the public starts asking enough, these different entities are going to be interested in doing it, because they're going to realize there's a problem and that there's a need to be filled. And that could help. I know that a lot of the vets that we talked to in Sonoma County said the reason we started doing it is our customers were bringing them back in brown bags. And we had a container in the back, and we said, well, why not? We sold them to them, so it's okay. But they only do it for their clients, and they don't want to advertise free collection for the rest of the city because then they end up with all these Sharps. And especially when one pharmacist told us, we don't want to do the program because now you're telling us they're required to come back in containers, and containers take up more space in my bin. And then it costs me more money. So you see, there's a lot of things we have to play with. But even if we can just get one big TV piece, and then all of us can play it, we can put it on the community service channels, and just up and down the state just start educating people. To me, that's at least the start. And that's the PR piece of, you know, don't throw it in the trash. Here's what happens when it ends up. It doesn't go in the recycling bin, but, you know, we can do this and this. And if you're not able to find something locally, please ask your doctor, please ask your pharmacist, because that just continues to keep the awareness up. I don't know if anybody thinks that's an okay idea, but that was something I was thinking about.
Good idea.
Okay, good. Thank you, Jeffrey. Yeah, because I thought that's something we could do, and then we could do a social media campaign around it, and we've got a social media firm now that's getting really good at this stuff of teaching us, and actually we're working with our partners on how to use social media more effectively, because it's basically a free and very fast way to spread information really fast. And so, matter of fact, I think Donna was taking pictures today and tweeting them and doing all the social media things to promote the event today. So we can do that with this too, and just kind of make it a public campaign of awareness and education until we build enough momentum that we can kind of get over the hump and get to the solutions.
What do you mean by we? We can do this. You said
CPSC
or
can.
some people in the room?
I think it'd have to be a collaborative. Jeffrey was asking who's the we, and that's always a good question. And the we, I'm thinking it's all of us in the room that have access to social media. If we agree on maybe a general plan, or even Donna and I can talk to some of our key partners here, including the hospital, because what a great partnership. I think this is going to end up being long term. We can actually come up with a plan of messaging that's medically correct, truthful, and just hits to the point that you can't, no pun intended, you can't put them in the trash. And these are the ways that we can do it. Or can you ask your pharmacist, can you start asking the people you're getting them from? Or buying containers and bringing it here. So we'll be noodling on that, but we can be the leaders at CPSC of the campaign, and then everybody can just feed off of that, of our lead. That sounds good. Okay, good. Other ideas? Yes?
I have an idea. I guess just speaking of making sure that people understand, people kind of believe us. It is a threat to a lot of people who work especially on that industry in the MRFs. We could also bring it to our local churches. You know, when people go to church, they do believe our priest, they do believe the person who's telling us, and they make it a little more responsible. They do take that extra step. So I think if we could educate the church to help us expand that, it's going to be something that's going to be very strong. And it's
Sorry,
gonna
your
help
name
us
and
out.
you're with?
Edgar?
Edgar, and you're with?
My name's Edgar.
I just want to
And
keep
I'm
it here.
from the CRRA program.
Oh, you were one of the students in the
Resource.
the California Resource Recovery Association, another
Yes.
one of our partners. Wonderful. So you're one of our students.
Yes.
Welcome, welcome. Well, that's a great idea, because actually churches are where a lot of people go to for their information. So as part of our social media thing, one of the things we could do is actually lay out, these are the different groups we're going to target to get information to. I don't know how many churches are using social media now. More? Really? Awesome. Okay. Well, there we go. Because it's free, exactly. All the nonprofits. Yes, Bill.
I guess the jaded view of Sacramento is there's always winners and losers. And if I'm a local retail pharmacy store in this state, I'm worried about the mail-back programs and more of the drugs going to mail-back and people not coming to my local pharmacy. I mean, would there be any ability to go to the guys in Sacramento and say, look, you know, we want to do a mandatory retail take-back program. At the same time, you know, if you want to sell drugs through the mail in California and it's a Sharps, you have to provide a prepaid Sharps container. So all of a sudden, the economics that favor the mail-back programs for drugs, the online pharmacy programs lose their competitive advantage because now they're providing $35 containers. So the local pharmacies would have a financial advantage by agreeing to a bill that would require both, hard pharmacies in the state and the online pharmacies providing the solution. And is that something that maybe the retail stores would be able to buy off on and give us a program in California?
Okay, so you're suggesting a bill idea that would be supported by the Pharmacy Association.
Right.
The retail pharmacy, and I'm sorry, I was trying to make sure Katie was capturing the notes on this, but the exact bill would say?
Basically, if you're a retail pharmacy and you're selling, if you're a pharmacy and you're selling Sharps, if you're in California, you have to take back Sharps containers from the public for free. If you're not in California, you have to offer a mail-back program to your customers.
A mandatory retail take back, basically, and online if you're buying them online.
And the online option will be much more expensive. And so hopefully the local, in-state guys would buy off of it if they like that because it gives them a competitive advantage against the online guys.
I think the key is to getting the support of the pharmacies because the Retail Association has been a big supporter of product stewardship, partly because what they see happening is things like the ordinance that's mandatory retail take back locally, because they're concerned they're going to be left holding the whole bag and the producers are not going to have any share of the responsibility. And so that would be interesting to see if we could get their support, because I think you're right. The more, as a matter of fact, somebody here was telling me their daughter has diabetes and they're buying everything online. They never go into a pharmacy anymore. So that's an interesting point, that they're actually going to gain foot traffic by allowing a return. And one of the things I wanted to do is do a pilot project where we actually test that. Because if we can go to retailers and say, look at the increase in foot traffic in this study that we did at pharmacy X. When we put the box in, we saw X number of new customers per month for the next 5-6 months. That resulted in X amount of peripheral sales because you put it back towards the pharmacy, so they have to walk through the whole store, and of course their eye's going to catch the bubble gum, or this or that, and then they buy something more. And that's what sold us on the oil program here in California. We actually did a study that showed that when you allow oil and oil filter recycling at your facility, at the Kragen stores, you'll actually get like $60 or $65 of sales per person or something that comes in the store just to return their oil. That would be a great little study to do if we could find somebody to fund it and do it. And it could be, again, a partnership, and that could be one of the projects, Katie, that we're listing and making sure we're capturing, because that really would give the story that would convince them to support something like that.
But if every retail pharmacy is doing it, then that competitive advantage between the hard pharmacies is kind of lost.
Yeah, right.
What you're really trying to do is give them the advantage over the mail guys.
Right, so the advantage is over the mail back, or the everything buying off the internet, yeah. Okay, very good idea, Belle, excellent. Yes, Nancy.
A couple of comments on some of the things and thoughts on what was said before. One of them, with partnering, with educating, keep in mind educating the professionals, because while we're educating the public, and then they go to their doctors, and the doctors go, I don't know what to do, or the pharmacists. So if we give them some education as well, so that they all have the same information and the same thoughts and are on board, and partnering with the professional groups, the pharmacy group, the CMA, the California Medical Association, California Nurses Association, APIC, any other groups that are professional groups within the state that would want to partner and help with the education and with working on this. Also, something that a few of us were talking about, partnering in your community with the hospital where you work, and the intake people, where I would start, it would be your infection prevention, infection control person, because we're kind of tapped into that. And then also your environmental services director, because they would be the ones most involved and most interested and could help take you through whatever channels and get to the right people within the organization to see if you could work something out. In the same respect, if you're working with the hospital, because we do have regulations, if there could be an immunity or an indemnification or exemption for the hospital for those Sharps that they're collecting from the public, because we have so many regulations, to have something that helps us not have to worry about that. It makes it easier. And one last idea, I don't know if this came up, but when we were talking, someone mentioned about the cost, additional cost for fluorescent bulbs that have to do with, or batteries that have to do with disposal. Now, I'm going to regret saying this, but with an additional cost for a syringe, where that money would go into programs. And I hesitate saying it because hospitals will be hit really hard, and we're already doing that. But if there's a way to separate it for public consumption, if something can be done where funds are generated there.
So in the sale of the Sharp?
In the sale of the Sharp, where there's a surcharge, like with cigarettes or something, where that surcharge will go actually toward proper disposal programs, or some sort of the funds that would help fund these projects.
Well, I'm glad you brought that up, because in a true producer responsibility system, the producers would design and operate the program, and fund it. And generally what they will do is just build it into the product price. And in many other places, that's what happens. Ontario, Canada, I've got a yellow bin out on the front table that I got when I went to their pharmacy with the local stewardship organization that was showing me around Toronto, and they said, yeah, just take it. That's what we give to all of our patients. It's just part of when they buy the Sharp, they get this container, and they bring it back full, and we take it. And they kept saying to me, why do Americans make producer responsibility so hard? They don't understand it, because they do this for tires, pharmaceuticals, Sharps, electronics, batteries, lamps. They expect to have in British Columbia every product under producer responsibility by 2020. They just know that this works. They just found that it works. And so they now are in a cookie cutter mode. Matter of fact, the last round of products that went under product stewardship in July was 9. They're doing them in clumps now, 9 at a time, by the Department of the Environment. So I always give my hats off to my colleagues up in British Columbia. They're doing a fantastic job and really showing us how it can be done. And the thing that they also pointed out to me was 90% of the companies that operate in British Columbia are the same companies and pharmaceutical companies that operate here. And the haulers and the Stericycles up there, and it's really the same companies. So this shouldn't be a news flash that, you know, how to do it. They know how to do it, but it would be in the product price, and that's the sustainable funding part that we're all looking at, because we all know that there's a lot of ways to do a program, but the question is who's going to pay, and what portion of it are they going to pay for? And the big cost in this game is disposal. So, Mike, you had another comment?
I'm just going to read what I was referring to, the SB 41, that is law. So I'm going to actually pull it up.
You're not going to read us law, are you, Mike?
I'm just going to go over it because this
It's after lunch. That's a tough one. Okay.
This is just a little paragraph of it. It says, in order to provide for the safe disposal of hypodermic needles and syringes, a pharmacy or hypodermic needle and syringe exchange program that furnishes non-prescription hypodermic needles and syringes shall provide consumer with one or more of the following disposal option. 1, it shall establish an on-site safe hypodermic needle and syringe collection and disposal program that meets applicable state and federal standards for collection and disposal of medical sharp waste. 2, it shall furnish or make available mail-back Sharp containers authorized by the United States Postal Service that meets applicable state and federal requirement for the transport of medical sharp waste, and shall provide tracking forms to verify destruction of a certified disposal at the certified disposal facility. 3, it shall furnish or make available a Sharp container that meets applicable state and federal standards for collection and disposal of medical sharp waste. So this is the actual the state of California law effective January 1st, 2012.
Yep, it's on our website, on our Sharps webpage, legislation from last year, so people can go ahead and look.
And this is something that at least gives us some background information and the data to substantiate what you're talking about.
Great, thank you, Mike. That confirms exactly what was in the law, if there was any question. Okay, any other ideas? Yes, and we'll get the microphone over to you. Please say who you're with, so people know in the audience who's speaking.
Hi, I'm Vivian Lockcourse, and I'm also a CRRNA graduate.
Congratulations.
Thank you. And I guess one part, I mean, I'm glad we're focusing on the collection of it, but I think there's a second part, and that's the disposal. And if these containers are being, captured and buried or incinerated, that really isn't the solution either. So I think in thinking of the solution, we also have to think on ways how these sharps can be reused or recycled, and if that can be done, will that also solve offset the cost that's associated with
the collection
of it?
Well, you know, obviously the mantra in our industry generally is reduce, reuse, recycle, and reduce is first. And but we can't source reduce, and I think Tom was explaining with the pen needles, that's actually great in that they're reducing the volume of needles that are going out there. But then we end up with this little tiny needle that he's worried about. So actually one of the email points somebody emailed in was, can you do it with a fluorescent green or yellow or, you know, something so that if it does fall on the ground, nobody steps on it. But reuse of this particular product sounds problematic to me. I'm looking at our resident epidemiologist, but I'm thinking that's probably not a good idea. So I'm thinking maybe, but it could be the container or something that doesn't actually puncture the skin could be reused. And I doubt that the cost of the metal and the low value plastic would outweigh the cost of collection. I haven't run the numbers, but it's just a wild guess. I'm sensing it probably wouldn't. Some products, like when you talk electronics and you've got gold and titanium and you've got really high value metals in there, that's a different story. You may end up being able to at least cover your costs, but it's hard. It's hard to do that. And incineration in general of these kinds of, I think our first layer problem is just to make sure that people are not getting stuck. That's problem number one. This is an onion. And then we'll start getting into, and I hope the companies are listening about, and I know Tom's company's talking about this at Ultimed, how to be thoughtful throughout the whole life cycle of the product. Because we do need to rethink design. Can it be, you know, can we do a transdermal delivery of this product? Does it have to use a needle? If it does, can we do the kind that pulls back? It's the retractable kind. If not, you know, how do we get these back safely? I mean, there's just so many different things we need to look at. But this first priority to me is that this not hurt people, and then we can get back to that other stuff, because this is a healthcare issue first, I think, and a waste issue almost second. And that's what the way we've been kind of talking about it. It's not really I mean, our landfills aren't full of needles. That's not that's wiping us out on landfill capacity. It's things like carpet and paper and all their stuff, but it's more of a health issue first.
And then another compelling public service would be the little kid picking up a needle outside the Starbucks.
Yes.
I thought that was very compelling, and if I saw a public service announcement with that image, I would probably think about it.
That's a really good idea, actually doing that kind of visual in the, or maybe doing if we could raise enough funds, you know, collaboratively to do a campaign like that. And I don't think it takes a huge amount of money anymore with the new IT technologies and videographers and things, the internet. We could do a good campaign and a good little short YouTube that gets virally spread, you know, that tells people, that it could even go nationally, even beyond California. And our companies here are beyond California, they're national. So, and I network with we have partners with the Northwest Product Stewardship Council, the Connecticut Product Stewardship Council, they could all do it too. So we could make it a universal message. It's a great idea. Jeffrey.
Yeah, I appreciate the comments of the last speaker.
I think it's just the angle of it.
If the last speaker, okay, about the waste involved in this program. You know, I'm certainly a zero waste advocate myself, and don't like to see all this single-use stuff and, you know, hard red plastic containers just being, you know, discarded or melted and buried or burned up or whatever. The beauty of a true EPR system here, if we get a state law like that, is that then puts the responsibility on the original manufacturer, which is designing these medicines and these injection products. If they have to deal with it and they're responsible for all the costs and the resources used in these single-use systems, they can put their attention to figuring out a better system. You know, thinking about the entire life cycle of the whole delivery system. And, you know, maybe they'll come up with a better idea that's a lot less resource intensive and wasteful.
Thank you, Jeffrey. That's a great point. Oh, who's ringing? The phone just rang in the room. That's an excellent point about producer responsibility, and one of the reasons I really got behind this entire concept as a policy approach is because it does create life cycle thinking. And when the producer who designs the product and markets it has to pay for the end-of-life costs instead of what, you know, in economic terms, externalizing that cost onto the public sector, they will very quickly, as a profitable company, want to figure out how to get those costs down. And that's where you start seeing the free market and the competition actually work, because then you've got competition and thinking and innovative creators, designers rethinking what they're doing, the whole system costs. But when it's just sell the product, it's gone, then there's no financial reason for them to be invested in that. And I think it's very commendable that Ultimed and the company and the corporate leaders are actually interested and willing to take this on as a company. And that's why I was so delighted to invite Tom that he could come today.
Nancy had another idea.
Oh, great, Nancy's got another idea. Tom, did you have another idea too? Okay, so Nancy first.
The light bulb went,
That's
light
good.
bulb went off when you made a comment. Is this not working?
It
does.
It tends to go on and off.
Oh, okay. In the hospital, we have to use safety devices. And if they don't exist, then of course we don't have to, but every Sharp has a safety device. Legislatively, there's no reason in this day and age to have Sharps that don't have safety devices. They should be out in the community. That should be the only thing accessible. Legislate that, work on legislation to do that. So we can, there are other issues of if there's failures and so on, but at least get rid of the non-safety Sharps.
That's a really good idea. I didn't even think of that. Why would we mandate it in hospital medical environment and not where people are using them at home, where children might be around, or other,
And safe in their home even.
and be safe in their home?
Their kids accidentally be pushed out.
That's very interesting. Thank you for that. Yes, Tom.
Yeah, first of all, I wasn't going to talk about it, but just to comment on the last comment, we also make safety charts, and they are available. The negative about them is they cost, because of whatever mechanism you attach to them to make them work. The cost of them, as you know here, they're quite a bit more expensive than the non-guarded devices, and it's always an issue as to, you know, how that would go in that community. That there's very cost sensitive if the cost of their syringes tripled or whatever.
So again, we come down to who's going to pay.
But the thing that made me jump out of my chair, I think it's a brilliant idea, and really looks at a lot of study. In addition, I'll give you some of the background reason why. Is the gentleman in the back, the pharmacist, that came up with this idea of making the mail order people pay for mailback Sharps. There's an underlying issue here that could really be powerful legislatively in California or any other state. First of all, getting into any type of a drop-off type point of purchase return in California and other states, there's always going to be a few people, without naming them, that are against this whole idea. And so one of the first, when you're against something, you look for political allies. And one of the first things they'll hit on is the State Pharmacy Association. And there's, of course, two major blocks within the Pharmacy Association. There's the chains and there's the independents and small chains. But in any case, what they do is they run to the pharmacists and the big chains, the Walgreens of the world, that type of thing, and say, well, you never want to do this. You're going to cause the legal liability problems having these Sharps in your store. You're going to takes up space, it takes up labor costs, and I think they lay awake at night all night long just thinking of every reason that they could convince the pharmacists that this is, you just don't want to do it. So, and they're successful, generally speaking, in convincing them. I think, I say this with a little bit of ridicule because in Canada and some other places where it's common practice, they don't even think about it. It's not a big deal. But nevertheless, they're making a big deal out of it to, let's say, go forward with another agenda. So what you have to do legislatively here in California is one of the first things you have to focus in on is the Pharmacy Association and the local pharmacists and also the chains. I've got a few ideas on that, and that is having to do with the chains. You have to, show them places and tell them to go up to Toronto and to go up to Canada and see places like Shoppers Drug Mart, big footprint for stores like they have, and see how they operate up there, and it's no big deal. It's just, operations speaking, it's not a problem. From the sales perspective, you have to remind these people that the diabetic customer is their most important customer, and if they offer these types of services, it's good, not only for the big chains, but also for the independents, because, like I say, here comes the elephant in the room, and that is mailback. Mailback, both with the PBM mailbacks and also some of the other mailback programs that are out there. We estimate that about 20% of the syringes and pen needles right now are coming through the mailback distribution. And what's happening, or what I'm hearing just anecdotally from talking to pharmacists is when they lose a customer, a diabetic customer in particular, to mailback, they don't see him anymore lots of times. I mean, you know, it's not only just for their insulin, syringes, and whatever else they get, but they're not also coming in their stores to buy, you know, other things, toothpaste or whatever else they do when they're walking through the aisles. So these are very, very important customers, and anything that could have some type of a bill that would have appeal both to the chains and to the independent pharmacist, and saying, this is, hey, you guys get this. This is a way to encourage these diabetic customers to get back in your stores again that you've been losing to all these mailback guys and the PBMs. I think it has a tremendous amount of leverage that all of them should be able to listen to. And then again, that also, you know, these. I think it's a little easier lots of times with the independents. They're local, you can talk to them, but the chains are, you know, oftentimes controlled by somebody 3,000 miles away by remote control, and they, you know, you have to convince their legal department, their operations department, their sales department. But really, if they all studied the situation, they would realize, I think, that this is just, frankly, a bunch of BS that's been told to them, and that it shouldn't be much of a problem. But again, this suggestion in the back there, having that type of thing, I think it's you know, it's really clever. I think it's a great idea.
Well, and one of the things, you know, a lot of times we know a lot of what to do, not everything. These groups are really good for a lot of brainstorming, a lot of great ideas, but, you know, there's got to be funding behind some of this stuff. Who's going to do the outreach? Who's going to take the time? Who's going to put together the campaign? And these kinds of things don't happen by themselves. So that's something the Sharps Coalition, and we can talk to them and work with them on, that maybe, you know, ultimately we maybe should design a campaign and a plan and attack and estimate a cost, and then go out and let everybody know what that would be that supports these concepts, and then, you know, start the campaign and maybe, you know, prioritize who we start targeting the education to first. The Pharmacy Association, the Retailers Association, the Epidemiology Association, the hospitals, infectious disease officers, because there's a lot to do. And what I've seen repeatedly is that we kind of get to the place where we kind of know what it needs to be done, but we don't have the funding to do it, and there's no one entity set up to do it. So maybe that's a bigger conversation, and I'll be talking with the Sharps Coalition and the other folks in the room. And actually, I think we may want to start a listserv just for the people that registered for this event, and start brainstorming some ideas on that listserv, and maybe have some conference calls and see if some ideas and projects can come out of this that really work. Because the time has come when something has to be done. But you know, there'll only be so much I found that can be done through volunteerism or squeezing it in as part of your job. I mean, everybody's so overloaded. We kind of have to have somebody in charge of the ship and focused and doing and sending out messages with kind of keeping the team all going in the same direction.